Here we are in another episode of Fill in the Blank. I'm here with Dakota Linton, who, did her transgender changes now, taking male hormones. How long has it been now?
It's been 3 months.
3 months. So,
Yes.
how's that going? You see any change? Any?
A lot of changes. Like, I'll be
Your
talking.
voice definitely sounds deeper.
Yeah, it sounds like I'm sick right now, but that's just my voice dropping.
You are you liking the change?
Oh, yeah,
It's an
definitely.
open experience. It's not like you don't like smelling a little bit
No,
rankier.
I've kind of liked guys' musky smells anyways, so that doesn't
Well,
matter
that's
to me.
that's a plus. I'm telling you, sometimes I spray myself with deodorant twice. I don't like that. But, hygiene's important. So we're here to talk about gender dysphoria. What is your idea of gender dysphoria, or what do you know about it?
Gender dysphoria is a mental illness that can only be diagnosed by someone that can administer you separate hormones from the gender you were assigned or a gender therapist. It consists of making you feel out of place of who you are. Like when you look in the mirror, you see someone else as the opposite sex, and everyone else around you sees you as male or female, and you know that's not the case.
Yeah, not comfortable in your own skin.
Yeah.
Um, well, for the standard definition for gender dysphoria is the distress a person experiences as a result of the sex and gender they were assigned at birth.
Mm-hmm.
In this case, the assigned sex and gender do not match the person's gender identity, and the person is transgender. Evidence from studies of twins suggests that gender dysphoria not only has psychological causes but may have biological causes as well. So you think somebody can be just born out of the wrong place, or they develop that later down the road? Because it seems with a lot of therapists that deal with this type of thing, they think it's some type of development or some type of impact they've had as a child that experience them to feel such gender drama or gender trauma in a way.
I would definitely say you were born as a biological,
Yeah.
because I've always felt that since the first time I could probably comprehend words.
So it's both, yeah. So what they were saying about it both being biological and psychological, that's
Mm-hmm.
definitely a thing. Because you can definitely, not be born feeling like you're in a different gender, but then develop that later when you start to, if you're around a certain amount of feminine or feminine things, you might pick up certain feminine characteristics if you're a guy, and then if you're a girl or something and you're around a lot of masculine figures, you might develop those types of characteristics too.
Yeah, or when you hit puberty. Puberty is a good way to know, because then your body's literally changing, and that's not how you thought it would change. It doesn't feel right.
Yeah, you didn't think the change were going to be so drastic in a way.
Yeah.
Well, the diagnostic label gender identity disorder, which is known as GID, was used by the DSM until its reclassification as gender dysphoria in 2013, with the release of the DSM-5. You know what the DSM-5 is? It's what the psychologists use to, it's a certain type of criteria for each type of psychological mental illness in a way. It has all the symptoms, the signs, the definition, and everything that they kind of go on to determine if someone has a certain disorder or not.
Mm-hmm.
The diagnosis was reclassified to better align it with medical understanding of the condition and to remove the stigma associated with the term disorder. The American Psychiatric Association, publisher of the DSM-5, stated that gender nonconformity is not the same thing as gender dysphoria. You know what gender nonconformity is?
Gender nonconformity, as in like almost non-binary
Yeah, kind of like you're not establishing yourself with a certain group.
to
Yeah,
either or.
yeah. And that gender nonconformity is not in itself a mental disorder. The critical element of gender dysphoria is the presence of clinically significant distress associated with the condition. Some transgender people and researchers support declassification of the condition because they say the diagnosis pathologizes gender variance and reinforces the binary model of gender. The main psychiatric approach to treatment for persons diagnosed with gender dysphoria are psychotherapy or supporting the individual's preferred gender through any or all hormone therapy, gender expression, and role or surgery.
Mm-hmm.
I think that's an overall, I mean, basic knowledge of you want to support somebody's decision if that's really truly what they want. But you also want to make sure, I think a therapist's main job should be to identify if that person is actually wanting that. It's not just like some type of hidden trauma or some type of way of dealing with a conflict or a problem. I believe that if they can come to the conclusion that this is truly what the person desires, like you truly felt like you were out of place, so then yes, you should have support behind you in going after it. But the parents that get their kids gender changed at such a young age without the kid really understanding who they really are first, I believe that it should definitely be made when they're a little bit older. The decision should be made by the kid if that's really how they feel, because you don't know. It should just be the time and place that you're feeling, you know. Sometimes I wouldn't mind being a girl when I see like people holding the door open. I'm like, I would love that to happen to me. It doesn't happen to guys for some reason.
Yeah, and it should. It's called common decency.
Exactly, right? So, some signs and symptoms. Symptoms of GD in children may include any of the following: disgust at their own genitalia, social isolation from their peers, anxiety, loneliness, and depression. So you're sitting there counting all 5 of them on your hand. So you've experienced all these.
Yes, to an extreme.
Well, tell me a little bit about it. Like, let's talk about just disgust of your own genitalia. What was the factor in that? You just looked down at your
yeah,
chest
like,
and didn't like what you saw?
Yeah, what are these sagging, hanging things here? Like, they're disgusting.
Good God. Well, if you're a guy, you still got, some people still have some sagging hangers. Go ahead. And so then also social isolation. You also felt like you weren't in place with anybody?
All through high school, I was that one kid that everyone knew that was always by themselves. And they always thought I was just quiet.
Not the kid that ran like a ninja in the hallway?
Yeah, not that kid.
That kid was pretty cool, though, in my mind, now that I look back on it. Well, the only fact about that, why I say he was cool, was because he wasn't afraid to be himself. You know, he wasn't afraid, like, who gives a shit what people think? Yeah. I love that. It's hard because we're all, like, worried about what other people think of us and everything.
Yeah.
But, I mean, is that just how, because you were gender dysphoric at the time, that you felt that way, or you felt out of place, or was it the fact that that's high school? You know, it seems like there's a lot of kids that are, like, either too smart. It seems like the ones that are shy away from the group are really too intelligent to communicate with the dumber population, it seems like.
Yeah, I went through a lot of dysphoria through high school, but didn't know that that's what it was.
You were confused.
I was confused, yeah.
So that brings it to the next one, anxiety.
Mm-hmm.
And then loneliness and depression. Those two go hand in hand. If you spend too much time alone, we have a social skill that we need to fill every single day. So it's like Sims. If you've ever played Sims, there's a social skill.
Yeah.
You know, you can't just be disconnected. You end up talking to yourself, and even then you start answering back. It's your body's need for social attention, social attraction. Mm-hmm. So according to the American Psychological Association, transgender children are more likely to experience harassment and violence in school, foster care, residential treatment centers, homeless centers, and juvenile justice programs than other children. That makes sense just because they're seen as different, and in a society where you're not formed to the normal specifications of what we classify as normal, it would, if you're any bit different, it's either seen as poked at unless it's a very good talent or a very good skill, like being able to juggle or being able to play music or something. If you don't have that thing that is known as different in a good way, this, for some reason, is seen as different in a bad way. I don't see it different in a bad way at all. Since I've had you on my original podcast, you've educated me more on the subject of being transgender, where initially I thought it was just a joke, but I tried my best to make sure I gave you the proper pronouns and everything to deal with it. I don't believe you should be able to flip back and forth like in every 5 minutes, you know what I mean? But I feel like that's taking your power to a higher level. But yeah. It makes sense that kids would have a tougher time in school being harassed more by just people that, it seems like they're just uneducated people that don't understand what this person is dealing with, or what, we don't take in account the feelings of others.
Yeah, and what I'll never understand is that you've got like 13 to 15-year-old kids that are getting kicked out of their house. They're one safe space, because their parents would rather have a dead child than to have a
Really?
trans kid.
Whew.
You'd be surprised at the stories I see with other trans people I follow to talk about their lives, and I'm so lucky that my parents.
Can you give a story out that wouldn't really be like, you don't have to mention the person's name, but a certain story where some person was in that situation?
Yeah, I used to talk to a 15-year-old boy who was born female, and he was very nervous about telling his mom. It was just his mom he lived with because his dad died a long time ago. But he decided, because the friends he talks to online told him that he needs to go ahead and be honest with it. So he sat his mom down at the dinner table. They had a nice dinner, and he told her that he probably might be a boy, and that's why he's been dressing the way he's been dressing. And his mom just shut down completely, didn't say anything, and she got up, reached for the phone, and called his grandparents and said that he needed to go move in with them because she wasn't able to deal with that. And I was like, what did he just do? It's not like he's taking drugs or out on the street.
Killing animals or something?
Yeah, doing something that would make my parents really upset with me. So he had a decent conversation with you. He felt like he needed to tell you. It took a lot of guts to tell you. And you're going to go throw him out like that?
Especially your own kid. The
Yeah.
biological, right?
Yeah, it's your own child.
That's an ignorant parent.
Yeah, so that stuff happens quite a lot, and I wish it didn't.
Adults with GD are at increased risk for stress, isolation, anxiety, depression, poor self-esteem, and suicide. Studies indicate that transgender people have an extremely high rate of suicide attempts. One study of 6,450 transgender people in the United States found 41% had attempted suicide, compared to the national average of 1.6%. It was also found that suicide attempts were less common among transgender people who said their family ties had remained strong after they came out. But even transgender people at comparatively low risk were still much more likely to have attempted suicide than the general population. Transgender people are also heightened risk for certain mental disorders such as eating disorders. That goes with your body, just like when you don't feel comfortable in your own skin, that can develop two sides of an eating disorder. One, you just eat because you feel like crap and you don't know how to deal with your emotions properly. We all know the emotional known as comfort food. And then there's times where you're just like, I'm disgusted with my body, so you don't feel like nourishing it or feeding it because you want to look a certain way. And that's all society's models of how we should look and how we should act, even though that just depends on where we're from. Like, America has this idea, another country is going to have a different idea of what is known as beautiful. It's all about where you're from and how society is in that area. So for gender dysphoria in those assigned male at birth tends to follow one of two broad trajectories: early onset or late onset. Early onset gender dysphoria is behaviorally visible in childhood. Sometimes early onset gender dysphorics identify as gay for a period of time. The group is usually attracted to men in adulthood. Late onset gender dysphoria does not include visible signs in early childhood, but some report having wishes to be female in childhood that they did not report to others. That brings up the fact, when a teacher asks a kid, write down one thing that you could have that you wish you had, and then a kid writes down they wish they could be a female or something.
A princess.
Yeah.
Yeah.
That seems like that would probably be a good question for teachers to implement in schools, to identify if a kid is dealing with a type of gender dysmorphia, because some kids don't end up reaching adulthood to where they can change it, or reaching a level where they have the ability to change it, and then they end up committing suicide, much like this article is saying.
Yeah.
And I mean, that's a sad fact. It's really upsetting, but it's hard to establish something that's least dramatic, because it's relatively new still. Like new research is coming out, all this stuff. I mean, that's like with anything, but this is a relatively new, like, popular topic now. It's been dealing with the past couple of years where this has been sparking out, and like this wasn't known back in the day, and that's just because there might have been people that were dealing with it that were just too afraid to come out and didn't understand it. They just kept it buried in like a little secret. It's hard to think what's going to appear 10 years from now. So, when it comes to those who experience late onset gender dysphoria, will often be attracted to women and may identify as lesbians. This is for women. Yep, you raised your hand on that one. Before transition, they will frequently engage in transvestic behavior with sexual excitement. In those assigned to female at birth, early onset gender dysphoria is the most common course. So usually a female, that probably happens to do with maturity levels. You guys seem to mature a little bit faster than guys. I know I said that. Understand you're a guy. I do.
Yeah.
Yeah. But it just, when you're naturally born a female, you're a little bit more mature than definitely a guy. I mean, for you guys understand, like, we still think cooties until 15 years old. So it's like, you guys have a little bit more grasp on what's the sense of real or realism in a way.
Yeah.
So some causes of GID exist when a person suffers discontent due to gender identity, causing them emotional distress. Researchers disagree about the nature of distress and impairment in people with GID. Some authors have suggested that people with GID suffer because they are stigmatized and victimized, and that if society had less strict gender divisions, transsexual people would suffer less. It's just like I was saying, society is a strict thing. You have to follow a certain basis. If someone's a little bit different, we're the first ones to point that out.
Yeah, I have a story that goes along with that.
Go ahead.
If you don't mind.
Yeah.
Yeah. Before I started taking hormones, the doctor wanted me to do all these tests, so I had to go get a mammogram, which is something I've never done, just to make sure. I have breast cancer in my family, just to make sure I didn't have breast cancer or could develop it. So that was the most traumatizing thing I have ever done in a while, and that was like this past November. But they have this very generalized gender way of doing things, so the female part is nothing but pink. You walk in those hallways, it's like pink everywhere. It's like, oh my god, enough with the pink. You make it seem like I just had a girl or something. And then the male side apparently has all this blue. Well, they had to put me in the pink side.
You're probably uncomfortable.
Super uncomfortable, because I know I looked a little bit more masculine at that point. I had all these people staring at me because I just looked different. And when it came time for the ultrasound and the mammogram, like, I just start crying on the table.
Because you don't,
during the machine.
Because they're treating you like a female, and you don't feel like a female.
And I had asked the doctor to use male pronouns when I walked in. Like, hey, my name's Dakota. If you don't mind calling me that.
Did he kind of give you a weird look?
It was a woman, which I thought was...
She gave you a weird look?
She gave me a weird look. She didn't want to abide for that. She kept addressing to my mom like I wasn't there. I'm 22 freaking years old. You should be talking to me.
Yeah.
You know what I mean? So... She just made no
probably
eye
thought you're
contact.
like mentally unstable. It's like, because
Pretty much.
like I said, a lot of people are not aware
Yeah.
of all this stuff that's going on.
Yeah, I scared the living crap out of my mom because she's never seen me break down like that in front of people.
Did your mom handle it well?
I hid in the bathroom most of the time. Like, after the mammogram, I just kind of went into the room and
I understand.
shut myself off. But yeah, I don't talk about that much because it's still traumatizing to think about.
Well, I'm glad you shared that with me.
Yeah.
That's definitely something that if you're getting treated, especially when they're trying to put their hands on you and feel the feminine parts, and it's like you don't feel like you want those parts in general, so it's got to be very, very uncomfortable.
Yeah.
So see if you agree with this. A twin study based on 7 people in a 314 sample suggested that GID may be 62% heritable, indicating the possibility of a genetic influence as its origin. Do you think that's relative?
I guess.
I mean, 62% heritable. Do you think you inherited this?
No,
trait?
because I can't think of anyone in my family that's trans besides me.
But I'm thinking like genetic influence. So it's like, do you feel like there might be someone in your family that might be struggling with the same thing, just never came out about it?
I have these two nieces that give me like these really weird vibes when I look at them, but so far they haven't come out. But then again, they're
Not
really,
psycho killer vibes, but like
yeah,
they might be dealing with some type of
some
emotional
kind of
distress.
gender distress, but
Yeah.
they're very young, so I haven't questioned them about it.
You want to definitely wait till they're probably older.
Yeah, I definitely don't want to mix up whatever's going on in their mind.
So based on the American Psychiatric Association permits a diagnosis of gender dysphoria if the criteria in the DSM-5 are met. The DSM-5 states that at least two of the following criteria for gender dysphoria must be experienced for at least 6 months duration in adolescents or adults for diagnosis. That's much like with any type of psychological disorder. There is a 6 month period where they have to experience one, two, or more of these symptoms I'm about to read to you. So the first one is a strong desire to be of gender other than one's assigned gender.
Mm-hmm.
A strong desire to be treated as a gender other than one's assigned gender. That's basically the same exact question.
Yeah.
Just, I guess they're trying to fill up the paper here. A significant incongruence between one's experienced or expressed gender and one's sexual characteristics. A strong desire for sexual characteristics of a gender's other than one's assigned gender. You got 3 on your fingers?
Two.
You got 2 on your finger?
I don't know if it's a sexual desire. I've never thought about it that hard.
A strong desire to be rid of one's sexual characteristics due to incongruence with one's experienced or expressed gender. So where you might feel like you're lesbian or something. If you feel like, you attract to more of the male side.
Yeah, I definitely wouldn't be considered a lesbian.
So a strong desire or a strong conviction that one has typical reactions and feeling of a gender other than one's assigned gender. It's basically rewording like the first one. In addition, the condition must be associated with clinically significant distress or impairment. The DSM-5 moved the diagnosis out of sexual disorders category and into a category of its own. So that's a good thing. At least it's got its own way of dealing with understanding if someone is actually dealing with the emotional trauma or they actually feel like they're out of place and they might actually need to be gender reassigned. The diagnosis was renamed from gender identity disorder to gender dysphoria after criticisms that former term was stigmatizing. Do you believe that gender identity disorder is more stigmatizing than gender dysphoria?
Yes.
You feel like gender dysphoria is softening it up a little bit?
Gender dysphoria gives it more of a, I don't like to say disease because it is not a disease. It gives it more of that disease term. It's mental illness, I guess, per se.
I think anything like ADHD gets that type of crap too.
Yeah, but it's not really a disease.
I don't think of it as a disease. I think of ADHD as like a handicap. It's beneficial in ways, but it's also a letdown at sometimes.
Yeah. Gender identity, I think people get confused with biological sex. So maybe that could be a reason why that they've changed it.
So the diagnosis for children was separated from that for adults as gender dysphoria in children. The creation of a specific diagnosis for children reflects the lesser ability of children to have insight into what they are experiencing or ability to express an event they might not have insight. Other specified gender dysphoria or unspecified gender dysphoria can be diagnosed if a person doesn't meet the criteria for gender dysphoria but still has clinically significant distress or impairment. The International Classification of Diseases lists several disorders related to gender identity. Transsexualism, which is the desire to live and be accepted as a member of the opposite sex, usually accompanied by a desire for surgery and hormonal treatment. Gender identity disorder of childhood, persistent and intense distress about one's assigned gender manifested prior to puberty. Other gender identity disorders, unspecified and specified. Sexual maturation disorder, uncertainty about one's gender identity or sexual orientation causing anxiety or distress. Significant revision of the ICD's classification of gender identity related conditions is expected in the forthcoming ICD 11. As of August 2018, the ICD 11 lists these conditions as gender incongruence under conditions related to sexual health coded into 3 conditions: gender incongruence of adolescence or adulthood, gender incongruence of childhood, and gender incongruence unspecified. In addition, sexual maturation disorder has been removed along with dual role transverdism. ICD-11 defines gender incongruence as a marked and persistent between an individual's experienced gender and the one that is assigned at sex, with presentations similar to the DSM-5 definition but does not require significant distress or impairment. Even though they use a lot of fancy words in this psychological diagnosis of this is the actual DSM criteria for diagnosing this, they use a lot of words, but it seems really out of date a little bit too. It seems like it was created probably at the beginning. Even though they mentioned 2018, it just seems like they haven't really changed a whole lot. Like, I understand the sensitive aspect of changing it from gender identification disorders to gender dysphoria. That's a way better name. But the fact that they're establishing that a child doesn't have really the right to understand where they're at yet. I don't believe it's not that they don't have the right. I believe that they just might need a little bit more time to think upon the decision. You don't want to make anyone feel like they don't have the right to their own life.
You're honestly correct, because there isn't a lot of tests on this kind of stuff. Like, if you take testosterone, we don't know what might happen to my body and sometime in the far future. So there's a lot of stuff out there that still isn't confirmed by science. So I think it's gradually changing all the time.
Just like life, it's open to interpretation.
Yeah.
So for management, treatment for a person diagnosed with GID may include psychotherapy or to support the individual's preferred gender through hormone therapy, much like how you're experiencing. Gender expression and role or surgery. This may include psychological counseling resulting in lifestyle changes or physical changes resulting from the medical intervention such as hormonal treatment, genital surgery, electrolysis, or laser hair removal, chest/breast surgery, or other reconstructive surgeries. Yep. So even you were taking therapy before, or are you still taking it now? I'm not talking about hormone therapy, but regular therapy.
I just started going back.
Do you find it helping you a little bit more?
Yeah, what's cool about my therapist is that she actually works with trans people.
Oh, so that's a perfect therapist. You definitely don't want one that doesn't understand the whole idea or aspect of gender dysphoria or any type of transgender idea in the first place. If you're one that has one that's, I don't believe that a woman should be a man or a man should be a woman, that's not your therapist. You need to find somebody. Go to a better place. Get out of the South a little bit. So the goal of treatment may simply be to reduce problems resulting from the person's transgender status. For example, counseling the patient in order to reduce guilt associated with cross-dressing, or counseling a spouse to help them adjust to the patient's situation. Hormone treatment or surgery for gender dysphoria is somewhat controversial because of the irreversibility of certain physical changes. Breast growth appearing due to hormone treatment, for example. Guidelines have been established to aid clinicians. The World Professional Association for Transgender Health Standards of Care are used by some clinicians as treatment guidelines. Other guidelines outlined in Donald Traver's Transgender Care guidelines for treatment generally follow a harm reduction model, which is what can we get? You know what the harm reduction model is?
No.
It's basically what can we do to get your goal satisfied without causing a lot of damage. It's the least possible one that's going to do, so something's going to have this effect on you, and then you have another road you can take, like plan B, that's going to have this effect on you. which one's going to be the least damage to your life, to others around you, to yourself, to your emotional health, to your physical health. Therapists have to take these into effect if they use the harm reduction model. A lot of people don't. There's many models for psychotherapy. It's just like a trade. You're constantly learning all the time. So for prepubescent children, the question of whether to counsel young children to be happy with their assigned sex or to encourage them to continue to exhibit behaviors that do not match their assigned sex or to explore a transsexual transition is controversial. Some clinicians report that a significant portion of young children diagnosed with gender dysphoria later do not exhibit any dysphoria. Professionals who treat gender identity disorder in children have begun to refer and prescribe hormones known as puberty blockers to delay the onset of puberty until a child is believed to be old enough to make an informed decision or whether hormonal gender reassignment leading to a surgical gender reassignment will be in that person's best interest. That ending right there is perfect. Using hormone blockers is like a test to see, is this truly what you want? Is this truly what you want to experience? Without taking the drastic change of a parent just being like, cut the kid's penis off. Like, if you do that, like, it's not something that's you can surgically put back on. I mean, you can, but it's not something that's going to heal the emotional scars from that. That's what they're talking about. That's trauma that's going to affect that kid for the rest of his life.
Yep.
So you agree on them doing that with prepubescent children?
Yeah, I wish I knew about it when I was young, but I didn't know what puberty blockers were at one point.
Yeah, like I said, all this stuff is like, it wasn't major until it seemed like it just grew in like the past 5 years. It was like the major outcry. You seen like 2014 or 2015, there was, all these riots and people coming out with signs. And at least I saw on the news, it started to get highlighted. We mostly focus on the evil or bad of something else, not really on the positives of a movement that might spark something.
Yeah. They're tired of cisgendered people making decisions for them when they don't understand to begin with.
Yeah. You have to, you can never understand. I can never truly understand what you experience. You can never truly understand what I experience.
Yeah.
It's two different roads. We can try our best to understand and be compassionate and care, but that's honestly the best we can do as a society, and we don't do it as much. So for psychological treatments, until the 1970s, psychotherapy was the primary treatment for gender dysphoria and generally was directed to helping the person adjust to the gender of the physical characteristics present at birth. Psychotherapy is any therapeutic interaction that aims to treat a psychological problem, though some clinicians still use only psychotherapy to treat gender dysphoria. It may now be used in addition for biological interventions. Psychotherapeutic treatment of GID involves helping the patient to adapt. Attempts to cure GID by changing the patient's gender identity to reflect birth characteristics have been ineffective. So for biological treatments, they're talking about physically after primary and secondary sex characteristics to reduce the discrepancy between an individual's physical body and gender identity. Biological treatments for GID without any form of psychotherapy is quite uncommon. Researchers have found that if individuals bypass psychotherapy in their GID treatment, they often feel lost and confused when their biological treatments are complete. Psychotherapy, hormone replacement therapy, and sex reassignment surgery together can be effective treating GID when the WPATH standards of care are followed. The overall level of patient satisfaction with both psychological and biological treatments is very high. So, you know what epidemiology is?
No.
Okay, neither do I. So we're going to learn about it. Estimated rates of those with a transgender identity range from a lower bound of 1.2000 or about 0.05% in the Netherlands and Belgium to 0.5% in Massachusetts adults. From a national survey of high school students in New Zealand, 8,500 randomly selected secondary school students from 91 randomly selected high schools found 1.2% of the students responded yes to the question, do you think you are transgender? These numbers are based on those who identify as transgender. It is estimated that about 0.0005% to 0.014% of people assigned male at birth and 0.002% to 0.3% of people assigned female at birth would be diagnosed with gender dysphoria, based on 2013 diagnostic criteria. So if we checked it now, it would probably be a hell of a lot higher. Mm-hmm. Those seem like those are still pretty high numbers if you think about all the people in all these areas. Mm-hmm. This is considered a moderate underestimate. Researchers indicate people who transition into adulthood are up to 3 times more likely to be male assigned at birth, but that among people transitioning in childhood, the sex ratio is close to 1.1.
Wow.
So that's a giant leap.
Mm-hmm.
So the history, the term gender identity disorder is an older term for the condition in the DSM-5. So the American Psychiatric Association uses the term gender dysphoria described in the condition in its third publication of DSM-3 in the 1980s. So when I said it seemed like it was more out of date, they're still using a form that was developed in 1980. So they try and update it a little bit, but it seems like it's not enough. In April 2011, the UK National Research Ethics Service approved prescribing monthly injection of puberty-blocking drugs to youngsters from 12 years old in order to enable them to get older before deciding on formal sex change. The Tavistock and Portman NHS Foundation Trust in North London has treated such children. Clinic director Dr. Polly Carmichael said, "Certainly of the children between 12 and 14, there is a number who are keen to take part. I know that it's been very hard for the families is knowing that there's something available, but it's not available here." The clinic received 127 referrals for gender dysphoria in 2010. But we never heard about this. This is stuff I have to literally look up and research. Why isn't this being shown on the news, especially back then? It seems like we're more worried about Obama or Trump or some type of thing that's everyone can hop on. This is something everyone should be aware of too. The T&P completed a 3-year trial to assess the psychological, social, and physical benefits and risks involved for 12 to 14-year-old patients. The trial was deemed such a success that doctors have decided to make the drugs more widely available to children as of 9 years of age. As recently as 2009, national guidelines stated that treatment for gender dysphoria should not start until puberty had finished. Pharmaceuticals manufactures the drug triptorelin, marketed under the name Gonapeptyl, at 82 ruples per monthly dose. The treatment is reversible, which means the body will resume its previous state upon discontinuation of the drugs. So for society and culture, social characteristics are created and supported by the expectations of a culture and are therefore only partially related to biological sex. For example, the association of particularly colors with girl or boy babies begins extremely early in Western European-derived cultures. Other expectations relate to approved and allowable behaviors and emotional expression. So much like we're saying in culture where we deal with like how open one is to these types of things. Mm-hmm. You know, in America, there's a way where we're kind of closed off. Boys are seen as blue, girls are seen as pink. Maybe I'm a guy, I like pink sometimes. Maybe I wouldn't mind being in that mammogram of the girl's side, not the guy's side. You know what I mean? Mm-hmm. It all depends on someone's characteristics and personality traits. We can't all just define people into groups. Mm-hmm. You agree with that 100%. I'm not being wrong. Tell me if I'm wrong.
No, I agree.
However, research has found that anxiety associated with gender dysphoria persists in cultures, Eastern or otherwise, which are more accepting of gender nonconformity. That's definitely a true fact on that one. Mm-hmm. In Australia, a 2014 High Court of Australian judgment unanimously ruled in favor of a plaintiff named Nori, who asked to be classified by a third gender category, non-specific. After a long court battle with the NSW Register of Births, Deaths, and Marriages, however, the court did not accept that gender was a social construction. It found that sex reassignment surgery did not resolve her sexual ambiguity. Mm-hmm. So, why do we classify it as a disorder? With all this stuff and just educating yourself more on the fact, this is what they say. The psychiatric diagnosis of gender identity disorder, now gender dysphoria, was introduced in the DSM-3 in 1980. Arlene Isterlev and Deborah Ridicule have characterized the addition as political maneuver to restigmatize homosexuality.
Mm-hmm.
That was in 1980. Thank God they changed their view on that.
Mm-hmm.
Because, first of all, homosexuality was removed from the DSM criteria in 1974. So it seems like they're just replacing it in the new DSM criteria, which is, when they took homosexuality out, they decided that wasn't a mental disorder. How long until they're going to take out being transgender as a mental disorder? I don't think it's a mental disorder. I think it's we all have a road that we have to kind of choose in life. You know what I mean? And who are you going to be? Are you going to be the one that's nice to everyone, or are you going to be the one that's mean to everyone? It's the same thing. Do you wish to be female for the rest of your life? Do you wish to be male for the rest of your life? It's really tough when people go to the fact that they think God made you a guy, so you should be a guy. Well, if you don't feel like a guy, and if God is out there, why would he make me feel that I don't feel comfortable in my own skin?
Yeah. Doesn't he make mistakes?
Yeah, maybe he got drunk one night when he was making somebody and decided, hey. So it blows my mind, all the distress that comes with this, and I mean, it just, even reading even more into it, it's just like, oh my God, like the complications. First of all, let's talk about intimate relationships, okay? Because that's something you can probably shed a little light on here.
Yep.
How hard is it for you to get into an intimate relationship?
Oh my God, it's very hard.
You haven't found anybody that is open to the idea of it?
People that are usually open about it have a trans fetish, which is really disgusting to think about.
Like someone that's into feet?
They're called chasers, terminology, where they'll literally only date trans people because
that's what gets them off.
Yeah, and it's weird. It's like, because they don't
actually care about the person.
Yeah, they don't see you as that person that you know you are. They see you as your body, and yet you look masculine or feminine. I guess it's like a turn on to them, but that's gross. And those are the kind of people that I tend to come across on dating websites or.
Is there a transgendermeet.com?
No.
There's no type of transgender dating site?
They have small apps, but they're not really.
They have a farmers only. They should have a transgender app. Like,
yeah.
Are farmers in that desperate need of love? I'm pretty sure a farmer's not really a classification of a person.
It is now.
Like a job.
So yeah, it's very hard, and some people just don't understand fully.
I got an email about it's called grayfoxesmeet.com. It's an elderly site. I'm like, I'm 21.
I'm 21. Hey, maybe you'll find a cougar.
No, these weren't cougars. These were gilfs, sir.
Oh.
These were grandmas, like people that are like, I'll take care of you. I'm like, oh, okay. Well, I know what's going to happen if college doesn't work out. So, intimate relationships between lesbians and female to male people with GID will sometimes endure throughout the transition process or shift to becoming supportive friendships. Mm-hmm. Intimate relationships between heterosexual women and male to female people with GID often suffer once the GID is known or revealed. Mm-hmm. Researchers say the fate of the relationship seems to depend mainly on the woman's adaptability. Problems often arise with the cisgender partner becoming increasingly angry or dissatisfied. If her partner's time spent in a female role grows, if her partner's libido decreases, or if her partner is angry and emotionally cut off when in a male role, cisgender women sometimes also worry about social stigma and may be uncomfortable with the bodily fermentization of the partner as the partner moves through transition. The cisgender women who are likeliest to accept and accommodate their partner's transition, researchers say, are those more with a low sex drive or those who are equally sexually attracted to men and women. So they're saying if someone is going to be into guys and girls, they're a little bit more open to their partner if their partner decides during the relationship they want to switch from a female to a male. Just because they like men too, so it's like maybe something they're willing to be open to try. Yeah. It is definitely difficult probably for if someone is uncomfortable in their own skin, and they end up hiding it for so long, and then finally it kind of bursts out of them where they're in a relationship and they decide to change. It's like, whoa, it makes the other person feel like the person they've loved this whole time is not who they never really knew them in the first place.
Yeah.
But if you truly love this person, you should be able to overcome that, correct?
Yeah. That's also hard though if they're sexually just not attracted to them anymore.
Yeah, I mean, it definitely, if I'm dating a girl and she turns to a guy, I don't know how sexually attractive I am going to still be to her. There's definitely a way we can still be friends, but
Hmm.
I'm just,
Yeah,
I'm not attracted to dudes.
yeah. If you're straight, you're straight. It's nothing wrong with that.
So, this is what I wanted to talk to you about when it comes to the 16 facts on gender confusion. I'm going to read them off, and after we reach all of them, I want to hear if, after each one, I want to hear if that's right or not.
Hmm.
Okay? So, for number one, we got mental health professionals consider gender confusion that causes serious mental distress to be a mental disorder. It was formerly called gender identity disorder, but in the most recent revision of Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association, it has been renamed gender dysphoria, in an effort to reduce the stigma of often experienced by those afflicted with it. The DSM is used as recognized standard by mental health professions in the US and some other countries for identifying and describing mental disorders. So you believe it was very beneficial that they changed the name to reduce the stigma experienced with those of the people that suffer with this affliction.
Yes, because I don't think it's a disorder.
There you go. So that's a yes for number one. The APA and other mental health organizations do not consider all manifestations of gender nonconformity to be a mental disorder, but when it is severe enough to cause individuals significant distress, it crosses the threshold of gender dysphoria and is without a question a mental disorder. So you believe if someone is experiencing major extreme depression from being like they're willing to not conform to a certain gender, but they still have the symptoms of gender dysphoria. Do you believe that, without a question, that is a mental disorder? Because in my mind, that does seem as a mental disorder. If someone's not willing to choose whether they want to be a guy or a girl, but they feel out of place in their skin, and they're too depressed to do anything to change it, that might be a mental handicap that they're feeling in a way.
Um, yes and no, because I know non-binary folks, and from what the experiences they tell me, uh, I can't relate, so I don't fully understand. But they can have dysphoria and not be either or, because that dysphoria generates from identifying a certain gender. So if you still have dysphoria from being a female and from being called a male, and both of them just doesn't seem to work, then yeah.
Do you feel like the change for changing from what they are or staying what they are is just too much of a traumatic thing? You believe that they just feel comfortable if they just didn't talk about it?
I feel like, yeah, I think a lot of trans people would agree with that in general, if people just didn't talk about it. Because it is kind of,
That seems like an inner infliction problem in my mind, an emotional infliction.
yeah, a lot of trans people and non-binary folks don't want people to know that they're trans. They want to be able to pass. And they feel that people should just be able to look at them in a normal way.
You should.
Yeah, so,
Who cares what someone's into?
yeah.
So, individuals who experience severe gender confusion may sincerely believe that they are the opposite sex from their biological sex and believe they are trapped inside the wrong body.
Mm-hmm.
We should feel compassion for those who deal with gender dysphoria, but the way to help these individuals is not to amputate their body parts or to inject hormones. Do you agree with that?
Yes.
I agree that the fact that it shouldn't matter if you still keep the same body parts. A lot of people are like, then you have to cut it off, or you have to change that, or you have to do this, or you have to do that. That our hormones and body parts is what identifies us in a scientific standard. Doesn't identify us as a emotional or spiritual standard.
As soon as you identify as the opposite sex that you were born with,
You should have full support into what you're doing, as long as that you're 100% sure that's what you want.
Yeah. You are transgender.
So one of the world's leading authorities on gender confusion, Dr. Paul Mikha, former psychiatrist at Chief Johns Hopkins University Hospital, warned policymakers and the media that are doing no favors either to the public or to the transgendered by treating their confusions as a right in need of defending rather than a mental disorder that deserves understanding, treatment, and prevention. I don't truly agree with that one.
I don't know.
It's talking about it's seen as more of a mental disorder that needs to be understood, treated, and prevented.
Prevented? There's no preventing it. This is something that you're going to live with for the rest of your life. And I think people need to come to terms with that.
So, autogenophilia is the condition in which a male experiences intense sexual arousal by cross-dressing as a female or by the thought or image themselves as female. Do you believe that person is gender dysmorphic, or do you believe that they are transgender? Because it seems like they're just having a kink of dressing up as a female but don't wish to change.
There's a very fine line between cross-dressing and, drag and being trans. Trans is because you were physically uncomfortable with identifying as your assigned gender at birth. Cross-dressing is more like for fun. It's an act. You're performing. So there's a big difference between both of those.
So sex change is biologically impossible, Dr. Mika stated. People who undergo sex reassignment surgery do not change from men to women or vice versa. Rather, they become feminized men or masculine women, encouraging surgical intervention in its reality to collaborate with and promote a mental disorder. Mm-hmm. So that's true, but I don't agree with, like I said, how they're stating it up to be a mental disorder. Mm-hmm. Public promotion of sex change attempts of celebrities can confuse and damage impressionable children. Dr. Kenneth Abloh, a prominent U.S. psychiatric, outlined the danger to children from this or misplaced praise, what is called as a mental disorder. Speaking about another celebrity who was a participant on a popular dancing talent show, Abloh stated it would be wrong to think that gender dysphoria cannot be kindled by celebrating those who have undergone sex reassignment surgery. By broadcasting, applauding, and mainstreaming the journey of a very disordered person who is endured by the public will likely continue to endure real suffering based on extraordinary, deep psychological problems, we suggest that a journey is smart, even heroic, one to take. That is very nearly insane, a psychologically destructive myth, and can erode our children's evolving senses of life. Just like we always look up to someone as a role model. We all have a famous actor. And if we keep going around saying, this person's so brave, with an impressionable children, even though that's not what they feel or that's not what they want, they're going to draw towards that. Oh, he's doing it, I might as well do it. It's like when a girl changes her hair color or hairstyle to match their favorite person's or something like that. It's like, Is that really what you want, or are you just going to change it a week later? You can't change your gender a week later once you go through all of it.
Yeah, I think it's very toxic.
So studies of children who exhibit gender confusion find that at least 80% of such children spontaneously lost these feelings as they grew older and were comfortable with their biological gender. Mm-hmm. That's good that they found what they truly wanted to be, but it wouldn't be any different than if they still felt like they were in the wrong place. A review of more than 100 intentional medical studies of post-operative transgender conducted in the United Kingdom in 2004 found no robust scientific evidence that gender reassignment surgery is clinically effective. In fact, Christopher Hyde, director of the University of Birmingham's Aggressive Research Intelligence Facility, who conducted the review, warned that there's still a large number of people who have surgery but remain traumatized, often to the point of committing suicide. I'm also teaching you facts. You don't have to agree with all of them.
Yeah, I don't know if that's true.
I'm just educating you on. Sex change surgery increases health risks, including suicide rates. A long-term Swedish study following more than 300 sex change surgery patients for up to 30 years, published in 2011, concluded persons with transsexualism after sex reassignment have considerably higher risk for mortality, suicidal behavior, and psychiatric immobility than the general population. The study found suicide rates 10 years of the surgery were 20 times of the general population.
Yeah.
A lot of what I'm doing is just to bolster my information in my research studies. I tried to bring in a little bit of factual stuff in here too that might educate you on some certain actual things like facts on gender dysphoria.
And you'd be surprised how fast that number will go down if people just knew more about it and would accept someone for who they are.
So, without even reading all the rest of these, I do want to ask the question, do Do you believe in the whole gender dysphoria, transgender battle in a way? I don't know if that's a proper way of putting it. It seems like it's a struggle for people that are dealing with it, and it seems like people are kind of being more combative towards it, but now we're starting to see that it's becoming more open now that people are becoming more educated on it. Do you believe that the factor, if everyone just took the time to do a little bit of research or maybe even taught this as a subject in school, much like dealing like being gay or being another thing, if it was taught more or publicized more in schools, being a little bit more open in the education system, do you believe that that might be a more beneficial way of educating the public and creating a more softer and gentle society towards these types of things? We wouldn't be so closed off, because it seems like all the older generations are the ones that are having a problem dealing with it because it wasn't relevant to them back then. They still don't understand it now.
Yeah.
It seems like the new millennials are the ones that are understanding a little bit more. We talk about them being more sensitive. They are being a little bit more sensitive, but are they being sensitive in the right way? Or are they just being crybabies over nothing? We need to understand that if we're more sensitive to subjects like this and topics of real concern, then if we're more open as a public, we'll be better grown as a society and more advanced.
Yeah, I think psychology should be a class that every student should take, because after you take a class, it like opens your mind up to things. You like, oh, maybe that's why that person's like that, and you feel like you can be more open to talk to someone about it, because a lot of people don't, and that goes for anything psychological wise.
And how long can you just bury something down?
It
Builds
last.
up and it breaks.
And you get angry and you lose people because of it, and you push people away because you don't think you're good enough to begin with. So, and it leads to suicide in really worst cases, to the point where if you reach that low, then that's very bad. That's bad.
Well, Dakota, I appreciate you explaining a little bit more about gender dysphoria for me.
Mm-hmm.
It was nice to get, hopefully I taught you some things, and at the same time, it's nice to actually educate myself a little bit more on the subject. And I appreciate you coming out here and educating young Robbie on these subjects.
Yeah,
Thanks
no problem,
again.
man.